Good morning. Thank you so much for joining us today for our fourth session in our Sharing Symposium series, Advancing Our Age-Friendly Communities. During our presentation, we're going to be using a poll device called polleverywhere.com. And for the username, put in friendly, and please go ahead and participate in our poll. We want to see, have you participated in one of the other Sharing Symposium sessions? You can click all that apply. So if you've participated in more than one, and we'll just give it a minute. Great. So it looks like we've had quite a few that participated in our session 1, which was Florida's journey to become age-friendly. Our session 2 was creating age-friendly community health and well-being. We also, during this time period, had the National AARP Livable Conference. And session 3, collaborations for community resiliency. If you did—
I'm supposed to be speaking on this and I can't get on.
If you were not able to participate in one of these sessions, we are going to have them all recorded so that you can look at them later, including the National AARP Conference. It will also be available online so that you can look at some of those sessions. So I'm just gonna, it looks like we've had really great participation between all of the sessions. So today is our fourth, as I mentioned, and this one is focused on advancing our age-friendly communities. And today we are going to be joined by Secretary Richard Prudhomme, Gail Holley, Isabel Rivera, Susan Holtzman, Michael Roman, and Bill Armbruster, giving us the perspective from Livable Florida, Safe Mobility for Life Coalition, which is a partner in these efforts. And then we're going to hear from Miami-Dade County and the City of Miami, and finish up the session hearing from Bill Armbruster, who works in our National AARP office and leads the livable community work across the states. So just to paint a picture for everybody, here is a map of our age-friendly network here in Florida. We have 42 communities that are in the network and the state of Florida. And to start off our program today, we're going to hear from Secretary Richard Prudhomme, who is leading the Livable Florida work here in Florida, to talk a little bit about Livable Florida and the action plan that was just approved. Secretary, thank you so much for joining us today.
Thanks, Laura. It's good to be here. Can you hear me okay?
Yes, we can hear you.
Okay, great. So yeah, it's great to be here and on the fourth episode of this series, which has been sort of really informative and exciting to sort of be part of the conversation and have the different inputs from individuals and organizations that are all working towards a livable Florida. Yeah, and I've talked in the past about obviously the older population, and as we know, the current population in Florida is for people over age of 60 is 5.5 million. But in another now 9 years time, it'll be 7.6 million, an increase of more than 38%. And interestingly, before the pandemic, we had probably about 600 or 700 people coming to Florida every day, and over half of them were over the age of 60. And of course, with COVID, that sort of took a hiatus, but now that trend is back on again. Sort of, we're seeing a lot more people moving to the state for various reasons, and obviously we're embracing that because they bring a lot of different experiences and value to add to their new communities. So we're excited about that. Unfortunately, I think what we do recognize as well is, and this is not just isolated to Florida, but talking about that silver tsunami, equating these increases in older adults to an economic and healthcare crisis, and obviously fueled by long-term care concerns and chronic illnesses and so on and so forth. And that has not been helped by the fact that COVID-19 has had a disproportionate impact on older adults. So unfortunately, we're seeing a resurgence of that debate on, how much should be spent on Social Security and healthcare for older adults, and also, social networks as well. And so unfortunately, we're sort of seeing more and more that sort of focus on older adults as being sort of an inevitable drain on the health economy and the economy in general, which obviously is incorrect. Yeah, we understand there are challenges that in promoting the health and well-being of what we're seeing in an increasingly diverse and older adult population here in the state, but those changing demographics really are showing us and presenting opportunities for communities to use social and technological ingenuity to develop solutions to our changing needs that can really move us forward. And before the pandemic, we recognize that communities that fare best in the future would be those that both tackle the challenges but also embrace the positive possibilities that an aging population creates, well, essentially becoming livable communities. And that, even though the pandemic has hit, that still remains true. I think what it's shown is, we know that livable communities, essentially, age-friendly communities are based on the social determinants of health, and the pandemic has done everything else to those social determinants, completely upended them, completely disrupted our ability to live and live well. And I think that's been a good thing, because now we recognize what we need to do to build stronger communities, and that's what's exciting about where we are now, because we now have an opportunity, and I honestly think a responsibility, to build and build better. But to do so, it's important to do that from the community up. Someone asked me, say, well, okay, we want you to talk today on your livable action plan on aging. I said, well, it's not my plan. I said, I don't do anything. I said, what it is engaging and empowering communities to embrace new ways of living and living well in their own communities. What happens is Miami-Dade and how they're building a livable community is notoriously different from Sarasota and Tallahassee and Jacksonville and everywhere else, as it should be. And so I think it's important to recognize that, as even though we have embraced Florida as an age-friendly state, it is very much focused on communities building their livable communities, their age-friendly communities on their own terms. And our job at the state now is, and with AARP's help, is to encourage, facilitate, and really be a cheerleader and provide guidance and support. But really, it's we want to hear and list from the communities, and that's why I'm excited that Isabel Rivera's on today, because Miami-Dade has done and is doing wonderful things. And a lot of you who are listening can sort of take note of what she's saying, and maybe some of these things that she's talking about, you can implement in your own way, in your own community, to make it a success. And I think that's the beauty about this, is that it really it is community-based, community-driven, and community-focused, as it always has been and always should be. And so, although I signed this action plan on aging, it is acknowledging that I have a responsibility to ensuring communities have everything they need to become age-friendly, livable on their own terms. So I take that responsibility very seriously. And obviously, I'm looking forward to continuing the conversation with not only the 42 existing age-friendly communities, but also those ones who are looking to be an age-friendly community themselves. And I was talking before the presentation today, is that really looking at all the chat in the previous sessions, everyone wants to know some community examples. They don't want to hear so much about, the policy from the state level. It's good and all that sort of stuff. It's good to know that you have the support of Elder Affairs and the governor's office and everybody else, but really you want to know exact examples, and you want to know how they implemented it in their communities and how you can do it to yours. And I think that's what I've liked to see, is you see that sort of really the living, breathing, fluid motion of age-friendly, is that conversation, those questions, that sort of thing. Hey, I want to do that. How can we do this? That is what we want to foster with this action plan, and the whole age-friendly is really generate a discussion, an ongoing, fluid, dynamic discussion of everything that's going on. And for example, COVID, that just all that does is present us different opportunities and challenges to address, and then we'll do that. Our response to COVID as an aging network has been exemplary. And we're rebuilding our communities, acknowledging the huge importance of social support networks to our welfare. And now we have a lot of federal investment to help us do that. And again, I stress the word investment. It's not spending money, it's investing in a better way of living, a better way of thriving. And I think that's exciting. And in our action plan, we do acknowledge that COVID has presented unique opportunities, but also what it's done is acknowledge the fact is that this action plan is very dynamic. It is going to be changing to the different opportunities and challenges that come our way, like COVID. And so that's what's exciting to me to be involved with. And so I guess all you need to hear from me today is that we will continue to listen. We will continue to provide resources as necessary to help you, guidance, support. But again, as you've done throughout this whole series, is just listen to each other, listen to the experts, listen to people like Isabel Rivera and Dr. Kathy Black and Gail Holley, who's been quietly working, really diligently on providing some really good, safe streets, safe transportation options for a long, long time now, with little fanfare. And to be honest with you, we have not done enough of talking about what the Department of Transportation does and how communities can benefit from that great work that's been done over there for many, many years. So again, we have an obligation to really, I guess, advertise and really publicize exactly what is going on in there, what good stuff is out there, and how others can adopt the same thing. So again, glad to be here. Obviously, I'll be here for the rest of the 2 hours. So I'm looking forward to hearing from Bill Armbruster as well. He's obviously got some other examples from other states and other communities that can provide some good guidance. But it's great to be partnering with AARP, who, as we go down this road, recognizing that we may take a step back every now and then, but altogether the movement is forward. That is, and we will adjust accordingly to whatever comes our way. But right now, I tell you, is an exciting time with an understanding of social determinants. We have opportunities, a responsibility, and obligation with all these resources to invest in what we are now calling Livable Florida. So, Laura, with that, I'm going to hand back to you, and I'll obviously be available throughout the session.
Secretary, thank you. Thank you so much. I wanted to take a minute, if you don't mind. You mentioned the action plan on aging that was just updated, signed, and is on your website now for Elder Affairs. That is kind of overarching Livable Florida and what Livable Florida is focusing on. And I know that includes, community choice, employment, volunteerism, community engagement, informal caregiver preparedness, healthcare and nutrition, and protection. And I know you were mentioning earlier that with the pandemic, there has been so much work being done out of the department in response to that. And I just wanted to take a minute to let everybody know that at the national conference, we did highlight some of those best practices that were being done here in Florida, some of the innovation that came out of that. But I wanted to say, as far as the action plan, that it is on elderaffairs.org. If you're listening to this and you want to go and look at that in more detail under their Livable Florida page. But I just want to take a minute to see if you wanted to speak to any of those tenets that are outlined as well.
You've covered it really well, to be honest with you. I think the best thing to do is read that. But you're right, those tenets are really, when we developed those, it was almost that was before COVID had really sort of had its impact, and I think what we're recognizing is the tenets have really have morphed as a result of what we've gone through with COVID. AARP has done some great work in the past of identifying critical issues of concern for an aging population, and you mentioned caregiving, for example, and that's a big concern moving forward. We, as we move and we age, we're concerned about long-term care. We want to make sure that that everybody who lives and ages in this state has options to be able to age in the right place. And we're sort of seeing, for example, that that caregiver preparedness is huge. It was a problem before COVID. It's a problem during, and it's going to be a problem for the future. I think that AARP had some stats. Was it 2.9 million caregivers in Florida provide unpaid care to people over the age of 50 in this state? Economic impact of $30 billion, which is huge. So the least we can do is to acknowledge that so much of social support, of that on that home care has been borne on those shoulders of those care partners for so long. But the federal government recognizes that, and some of the resources that we've received are putting funding towards addressing caregiver support more than they ever have. So I think that tenet of recognizing the burden that's been placed on caregivers for so long, we now have an opportunity to address that. And I think that's something that we are building into that plan is, how do we respond? How do we not just, basically put this unfunded mandate on the shoulders of care partners, because they can't do it anymore. The stress is too much. We have to do something. So one of those tenets is looking at that informal and formal caregiving doing a better job. How do we as communities step up and help that? Obviously, there's a concern there with direct care workforce. So obviously, one of the things we need to look at and work with the state and the federal government on coming up with a better, first of all, numbers of direct care workers, but a better trained direct care workforce to be able to sort of so that we can age in the right place and have people to help us do that. We can't do that alone. So we have to acknowledge that is something that's going to be incredibly important. But I think that one of the concerns with COVID is that it has raised very serious concerns about abuse, neglect, and exploitation. Those are some of the things that we're seeing raise its ugly head. And I think that more than ever, we're having to recognize that a lot of that comes from family crises. And so we're working on that as well. How do we create communities that really prevent that from happening? And healthcare, access to appropriate personalized healthcare, and adequate nutrition. I mean, we took nutrition for granted, but there's always been food deserts. Being able to live and live well, you've got to be able to have access to adequate and appropriate nutrition. And I think that's something. And who knew about the critical importance of mental health and well-being to individuals? And I think that's something that is going to be such an important part. So there's so many critical aspects to living and aging well, the social determinants I keep talking about, but there's some specific ones that really resonate and impact more. And I hope that we've captured those in that action plan. But as I said as well, that this action plan is very much a work in progress. It's dynamic, and and I do say in there that we will be revisiting it as situations change and different challenges come along. I mean, we're not done with COVID yet, and we just, but out of COVID, maybe COVID goes away, but now we have a new pandemic of mental health, of opioid abuse, of other sorts of abuse, neglect, and exploitation, of economic concerns, of economic uncertainty, and obviously nutrition uncertainty, and so on and so forth. So we have to be recognized that we can't just sit here and go, hey, we've got a plan, we're good. No, the plan has to be dynamic. It has to be fluid. It has to be ready to respond to changing circumstances. I think that's the exciting thing. So you mentioned those tenets, but those tenets are meant to be flexible and meant to be sort of changed and challenged. If so, please, when you read the plan, understand that it's just a plan, and we will be continuing the conversation with all of you to discuss how that plan helps you, or if it doesn't, how it should help you. And I think that is the exciting part of that. So I hope I explained it a little better, Laura. I mean, you were very kind to not to mention that I forgot to talk about the action plan. I got sort of carried away with the other stuff, but which is the cool thing about this is, as you can see, it's just a conversation that we have. These sessions are not us lecturing or preaching or presenting. It's more like hey, listen to us talk. And that's why we encourage a chat. Hey guys, what do you think about this? Are you on the wrong track? This is what I'm seeing in my community. Who can you link me with that can help this an issue in my community, which is number one that you haven't talked about yet? And I think that's the key is, and I'm neglectful to health equity and social equity is a big, big deal. And, you know, I'm talking about rebuilding and restructuring and everything else. We can't do that unless we address those inequities that have already been there that we're not aware about. I've said in the past, I don't know what, you know, from health and social inequities, if I haven't suffered it, I haven't been, you know, we need to talk to people who have had that ceiling of access denied to them and say, okay, this is it. We need to talk to those individuals. It's, I want to provide equity, you know, but I don't know unless I talk to someone who hasn't had that equity. And so that's very important as we develop this, conscious of the fact we need to rebuild, but rebuild recognizing that the original that we had issues that need to be addressed. So, you know, I think that's important. So again, I'm starting to go off track here, but I'll return it back to you, Laura, but
Sure.
please encourage people, chat, not only here, but take note of individuals you listen to today and reach out to them, and they'll love talking about this stuff, because it's, you know, it's life. It makes you feel good, and it's life. You take this home with you because you can help our friends and neighbors and families and with all this information. Thank you, Laura.
Thank you so much, Secretary. And right at the end, as you were finishing up, we put a question up here to everybody to say it in one word or attached phrase. What do you think is the most important priority that was mentioned for Livable Florida? And you can see, you know, health equity really showing up, connecting the dots, aging in place, state support, choice, caregiving, the power of local. I think that's really, really important. Opportunity. So all of the things that you mentioned go into this. I wanted to let everybody know that in the chat, we're also putting a link to the state plan, and we will also follow up, as we do at the end of these sessions, with an email that will include the state plan, but it's at Elder Affairs, and when you go to their Livable page, it is at the top. So thank you so much, Secretary. I am enjoying watching this build out as we're getting more and more health equity, aging in place, really showing up, age-friendly partnerships. And today we're going to hear about some more of those partnerships that we have here at the state level, and hear from examples at the local level as well. But thank you, Secretary. We really appreciate you giving us your perspective this morning. And we're going to turn over now to one of those state partners, Gail Holley, with the Safe Mobility for Life Coalition. Gail is the Safe Mobility for Life Program and Research Manager through the Florida Department of Transportation. Thank you so much for being with us today, Gail.
Oh, Laura, thank you for having me. I'm so excited to be here to really talk and share a lot of transportation resources and materials that are available for you guys to use. And I really love what the Secretary said about, you know, just learning what's available and applying it to your own community. So this is perfect timing. And, you know, I'm really excited to be sharing this information with you guys. Next. All right, so for over 10 years, DOT has partnered with the Pepper Institute on Aging and Public Policy at Florida State University to form a Safe Mobility for Life coalition. We are statewide. Today, we currently have 31 member organizations from across the state that represent not just, you know, all of our areas, so our rural, urban, and suburban areas. And you should recognize some of these logos as participants, but then also some of the faces. Laura and Anne-Marie and Kathy Black have been on the coalition, and Margie Bell from DOEA just joined us. And that we're just really actively working together to really help improve the safety and mobility of Florida's aging population. Next slide. Okay, so working together, like the Secretary, we have a plan. But we have a plan for a reason, to give us the guidance and keep us on track. So our Aging Road User Strategic Safety Plan is built together, and it actually addresses issues and for anyone over the age of 50 who are not just drivers, but also passengers, pedestrians, bicyclists, transit riders, motorcyclists, and operators of non-motorized vehicles such as golf carts. Aging road users are also in our Florida's Strategic Highway Safety Plan. And through Vision Zero efforts, DOT is committed to eliminating traffic fatalities and serious injuries on all roadways throughout the state. We do support that goal, and we do take it a step further, and we want to be able to provide to help reduce the crashes. We want older adults to be able to maintain their safe mobility and connection to the community, whether they're driving or not. Next slide. So I am not going to talk too much about the population because the secretary said it, but I just want to draw your attention because we do pay attention to this. So what our current population is at 20%, which exceeds other states. And what we pay attention to is also what's coming up. And we want to make sure that, that we are doing what we can now to actually be able to continue to provide and be proactive about reducing our crashes throughout the state. Next slide. So maintaining safe mobility is so important, and it's important because without available safe transportation options, older non-drivers are left feeling isolated and with a dramatically reduced quality of life. And this not only affects their health and well-being, but again, also their quality of life. And then we believe that maintaining quality of life means getting to not only where you want to go, just to get to where you want to go, not just where you need to go. That's really, really important. Next slide. So as I mentioned, we are committed to achieving zero fatalities on our roadways, but we do have some challenges. One being able to decrease the crashes as our population grows. That can be an issue. And also lack of transportation options might cause older adults to drive longer than it is safe to do so. Another challenge is that for most people, driving is central to their independence. And we like to ask this question in a lot of our presentations. It's personal. It happens to all of us because there is no certain age where someone is not considered safe to drive. So we'd like to say, just imagine yourself if you had to stop driving tomorrow. How would you get around? Do you have access to the places that you both need and want to go? And if not, how does that make you feel? And then those are feelings that I'd like you to kind of keep in mind as you through the rest of the presentation, but then also in your communities as you're developing and working on your plans. But I believe that we can overcome these challenges, and I'd like to talk a little bit about some of those solutions that we have to address them. Next slide. So I'm just going to go into what our role and some resources that you might not even know are available for you guys to take advantage of. Next slide. So DOT has actually been working on aging road user safety for over 20 years. I think that a lot of people might not realize that things that you see on our roadway now actually are part of that, and they were implemented based on research to help compensate for the natural age-related changes that happen to all of us as we age. So things such as your advanced street name signs, wider pavement markings, they're all there because we're trying to improve the transportation system for older adults. Our plan, though, it's very important that we want to be able to align and support other plans. So this does help communities as well. So everything that's in our plan and everything that we're doing actually supports the Florida Transportation Plan, Department of Elder Affairs Action Plan, and then also DOT's Vision Zero goals. We have available and support all roadway and design features that benefit road users of all ages. And if you think about it, even just the signs and markings I talked about that are on the roadway, while they help older adults, they really are used and help people of all ages. And we also want to be able to develop and distribute the resources using a very proactive, data-driven and research-based results approach. We've found that to be the most effective, and we really want to be able to, we continue to do that so that we can help road users of all ages be able to promote, and utilize mobility independence. Next slide. Okay, so we are very data-driven, and every year we do establish priority counties. But something to keep in mind that we do a little bit differently. These are not the counties, we do establish them for urban and rural. And these are not the counties that have the highest number of fatalities, crashes, or serious injuries of older adults. But these are the ones that we kind of balance that with, we take the 5-year average of the rate of the crashes involving the 65 and older, and we compare it to the 65 plus population in those states, in those counties. And that's really important so that way we can get a clearer picture of what's going on. And again, support being proactive. A lot of we do try to promote resources in these areas and give it some extra attention. But that doesn't mean that we don't do it throughout the state. We just do focus on those. Next slide. So for our resource development, everything that we're going to be talking about now, I really just think it's important to know that our coalition members do provide that expert insight to developing the resources. We have them sitting at the table. You know, Kathy, Laura, Anne-Marie have reviewed many, many resources as we put them together and offer their expertise in doing that, which gives us, you know, just helps us in so many ways. And then we also did we did some research, human factors research, to learn how we can best communicate our materials to older adults to make sure that what we're doing, because it is transportation, some of it can be very technical, and that way we make sure that we are conveying the most effective means to helping older adults reduce their crashes. And then our original resources are available free to both communities and individuals. We have them available in both print and digital. We really believe that we want to tackle every way in order to reach people with this message. Next slide. So we do have an approach to education. Again, I really like to draw attention to our coalition members because this was the outreach and advocacy team that actually sat down, and we needed to have, we wanted to kind of create a message to instantly let our target audiences know that we do offer a layered approach to achieving safe mobility for life. And it isn't just about encouraging people to stop driving. That's not what we're about. We want people to understand the impact that aging does have on driving, to be proactive about their safe driving skills, and to also plan for a safe transition from driving when needed. Next slide. So like I said, we do have a variety of materials available. And again, like I mentioned, these were all vetted out and through our coalition members to develop. And we do have a couple of series, or a couple of ones I wanted to draw your attention to, is that we do have a whole series on how to use transportation options in Florida, where we actually help people understand and provide tips and information on using resources such as, or options such as walking, bicycling, transit. We do offer information for families and caregivers, which is very helpful, how to have a conversation. And then we also do, my personal DOT favorite is the Roadway Safety Tip Card series, because we really want to be able to educate how both pedestrians, drivers can utilize these safety countermeasures that are on the roadways and be able to use them so that they can stay as safe as possible. And we really do have our all-inclusive guide to safe mobility for life. And it is written to explain more about each of those keys to achieve safe mobility for life, but it also walks people through and helps them create their own transportation plan. We all have different places we need and want to go, and how we can get there. So in our community, so it is important that we consider what our plan is and put a plan in place. And that guide actually walks you straight through it. Next slide. And we also have workshops, and they complement our educational materials as well. They are available virtually and in person when we are allowed to safely do so. And they provide more of an in-depth examples of how to use a lot of these different options. I do love it that these events, we walk people through, like Safe Transit for Life is a perfect example. Sometimes people might not use, transit as an option because they don't know how to use it. So we created this kind of workshop that walks people through and be able to share our resources as well. So these are all resources that are available, and also our PSAs. We've got some that walk people through on even how to build that transportation plan that I mentioned earlier. Next slide. And I loved, again, what the secretary said, because we are firm believers that we can develop these resources and we have the experts to pull at the table, but we cannot be every place and reach everyone. And community members know these are your neighbors, your friends, your family, and really to be able to get these resources into their hands. So we created a community partner program, and we encourage interested stakeholders to join, and then we train them like a lot on our positive messaging, how we've been using our resources, training on the workshops, to be able to carry this message through. And a really good example of the benefits of our community partner program is this past year during COVID, we were still able, when we couldn't do in-person events, we converted our workshops virtually. And then we, including our Keys to Achieve Safe Mobility for Life, our walking one, and CarFit. And we participated in drive-up events across the state, provided materials and information to volunteers to help get the resources into the hands of people who need them. And then we also partnered with Meals on Wheels to help distribute some of the materials. So we really tried to think outside the box, and we couldn't have done it without the input of our community partners. Next slide. So a few resources that are available to you online, and I've added the QR code so you can actually put your phone right up to your screen and go straight to the website. So one of the ones I wanted to highlight and share with you guys is a resource. So we do have an Aging in Place page on our website. There it contains, we just released a new video, an age-friendly communities in Florida video, and it really kind of talks about the benefits of age-friendly communities from the transportation perspective as well. So it's a great resource available there. We provide more information on transportation options, and we also mention and support the age-friendly communities in Florida. So we have links and information because we want to make sure with this partnership that we're able to share what is available to everybody and put it right there to make it easier for them to reach it. Next slide. And the same thing for our resource center. This is a place, if you can also, that QR code goes straight to the resource center page. And from there, you can actually order the educational materials. You can access the community partner information and webpage, and also be able to access and share our digital resources. Like I mentioned, we do have things in print, but we also know through our partners, we just been doing a lot more digitally through our social media. And we have a lot of resources that are just already vetted and ready to be shared and to kind of, convey consistent messaging throughout the state. Next slide. So a couple of things coming up that I wanted to just mention to you guys that I think is pretty interesting is the first one is, next slide, sorry, just getting so excited. Is that we are actually updating one of our resources that is our How to Choose a Lifelong Community, and it is a transportation checklist. It was a printed material, and now we've made it available. It's going to be available interactive online.
We cannot get back, that we cannot.
I'm sorry, I'm getting feedback.
Never get it back. So keep busy with things that make you happy, with things that you enjoy.
Yeah, we need to mute our phone, please.
Don't worry about the little stuff.
Okay.
And when you do find yourself worrying about the little stuff, acknowledge
That was a very good
worrying
message.
about the little stuff and let it go. Use the law of averages to outlaw your worries. What's the worst?
Please mute our phone. Thank
Sorry,
you.
guys.
Go ahead.
I'm just so excited, and then I'm like, thought it was a question. All right, so this resource is going to be amazing to you guys. We did develop a transportation checklist where we ask people to kind of like look at their own community in the areas of community design, street safety and security, getting around, and neighborhood support services. And then just to see, does your community meet, answer some questions, and does your community meet these needs? So while we have that available in print, we're actually moving forward and we're going to make it more interactive. It's going to be available online on off of our Aging in Place website that I just shared with you. I'm really looking forward to is that under each separate area, it's going to have a scoring index to kind of give people an idea of whether is, does their community meet these needs, but then also give them the access to the resources if it doesn't, like to ask some questions like, hey, if you scored between, this range, check out these resources, look around, ask questions, and we're really looking forward to that. But the biggest thing I'm looking forward to this about is that we are going to co-brand with AARP Florida, and to be able to share this and with Livable Florida and just everything, so we can make sure that we get this into the hands of everybody who needs it, and actually it can be used to really support everything that you guys are doing. So I'm pretty excited about that. All right, so next slide. All right, the other thing that we're working on, and this is definitely going to be something that the communities are going to want to know more about. We really want to create a more proactive, to our, enhancing our data availability, not just to the state level, but in the counties. So we really believe that this is a way for us to continue to eliminate fatalities and serious injuries. So currently we do on our data webpage, which you can access through that QR code, we do have a listing of the priority counties. We also link to eTraffic, which is FDOT's interactive GIS mapping tool. And then if you access the, click through and go to eTraffic, you can see a listing of the priority counties, but all the counties you can have, you see population data in there. But that's what we have now, but we're actually working on and being able to share our next phase. We're going to be expanding the county data that's available on eTraffic. It's going to be including the breakdown of all licensed drivers, the fatality crash involvement rates, what are the priority intersections in those communities. And then also actually we have a layer that talks about community partners. So you can know who the community partners are, if there are any in your communities. What I'm excited about this tool is that it's very visual as well. So you can turn on and off the layers and be able to really get a better picture of maybe where you can make a difference. We are actually going to be using this to be more proactive about our outreach and to connect the data with where we're distributing our materials and information. Again, the ultimate goal is to eliminate the fatalities and serious injuries. And we really feel like this tool, by sharing the data and making it more consistent and available, that we are going to get there. Next slide. All right, so collaboration is key to reaching Vision Zero. And again, we cannot do without you. So we really need to work from not just the state, but the local levels as well. And here are really some examples how you can help today. We would ask that you try and look at your plans or your communities and connect our resources into your plans. What are some of the things that you could do? And then also, how can you become a community partner? Check it out if it's something you're interested in. If you are already going out in the community and you want to be able to share these resources, just to sign up and join us, because we really feel like it's a great way to spread the resources. Sign up for our newsletter and listserv. We actually have a newsletter that focuses only on transportation. It's really been a way for us to kind of create articles and share information on everything related to transportation. I mean, we've written articles on wrong-way driving, our latest issue had, and also in vehicle technology. So we really try to address all that there. And then we just encourage you to spread the word, talk about what we have with family, neighbors, friends. There's a lot of everything that we're doing, because this is about all of us. This isn't about just, it's helping, make all of us safe and mobile throughout our lifetime. So we're really excited about that. And I would just encourage you to stay in touch. That QR code, it goes to our listserv. And one of the things that we've done with that is we've updated it so we want to have more targeted messages to specific audience. So if you're in healthcare and we have information that can help you there, we connect you directly to it. And then we just, like I said, have a lot of great information to share. But I'd love to answer any questions you might have.
Thank you so much, Gail. I really appreciate it. As we get into this next section, here's your information, which we'll be sharing with everybody. And we just wanted to do a quick poll. If everybody could get their phone out again, it's at pollev.com/friendly. What are the most pressing transportation issues in your age-friendly community? Pedestrian safety, roadway issues. And I want to say, as everybody's completing this poll, I agree with you, Gail. I think the roadway safety tip cards are some of my favorite out of this coalition. You mentioned earlier that a lot of folks are working on Vision Zero policy at the local level right now, complete streets policy. And these, I often hear that, they're looking for educational materials, for older adults, for all ages. And I cannot say enough how helpful these brochures are. They're already developed. They've been vetted. We've already used them out in the community. So if you're in a community that is looking at Vision Zero or looking to make some policy changes, I would highly encourage you to use that QR code and go find some of those free resources. We are getting some questions. We have a question in the chat for you, Gail, and I just want to take a minute to everybody. If you do have a question, please put it here. But somebody wanted to know, would you talk about how reducing speed limits can reduce crashes and injuries?
So I think the main difference with speeding is in crashes, it's the differences that people are traveling with the speeds. So that's something, so somebody that's even traveling really slow and someone that's traveling the speed limit, there could be conflicts that can cause crashes, and that's in the speed differential. I think that's important. I think everybody obeying the speed limit. I think speeding is something that we've discovered in our crashes during COVID. For some reason, speeding has just increased during that time when there weren't that many people traveling on the roadway. There were a lot more crashes related to speeding. So I think it's just, Florida, and I know this from people that travel from other states, our roads are just amazing. Like they're very visible. They are designed in a way to keep you safe. And if everybody can just obey those signs that you see out there, they're there for a reason. The speed limit is there for a reason, because that's the safe way to travel on that particular roadway.
Absolutely. And I know we also have one of our coalition members with us, Dr. Kathy Black. I don't know, Kathy, if you wanted to join in and have any questions for Gail, but we're seeing right now that the two pressing issues, and I think this is probably what we hear everywhere, is the lack of transportation options, wanting to have more accessible, available options in your community, and pedestrian safety. And I know we're all working towards making our roads safer here in Florida.
Gail, once again, for the Department of Transportation, I think we are all so fortunate for the incredible work that is being done to make the roadway safer for everybody, and all the wayfinding, not just for the residents of all ages, but for the visitors to the state. So really terrific work. It's always great to hear from the great work that's being done by the coalition and the Department of Transportation. Gail, when we think about our age-friendly communities, many of them are dealing with transportation issues. How can they best connect with the resources that you shared, and maybe with our metropolitan planning organizations, our transportation offices at that level? It's a complicated array of who is doing transportation at the county and the city level, and pedestrians and public transportation. What would be your suggestions on making those connections?
I think one of the things that I found is that that's why we align with existing plans. I think that finding out that the information's all out there, if we kind of just like a lot of the strategies and objectives that we have in our strategic plan would fit into a local plan. Plus, we've taken it a step further and have developed the resources to address it. And I think that's what we feel kind of like is the way to really to make it work, and really just talking about it a lot more. We just recently did a presentation for, I think, Broward MPO, and really just trying to make sure that they just know these resources are out there, and you just got to connect the dots. I think that, and you can just easily connect with us, by ordering the materials, you become one of our stakeholders. So we use when you get the resources, then if we want to connect in a community, we know people that we can connect with as well. So it's just kind of like, again, that connecting dots from all different levels, I think would be truly effective.
And Gail, the communities are all doing action planning, and then they're doing progress reporting. And it sounds like you already have the language as well as some of the metrics that would be helpful to these communities. And so for all the communities listening today, and for those who will be listening to this in the future, if you're involved in transportation agendas, please connect with Laura and I to make sure that you get connected to the coalition and the FGOT, so that we can really, as you say, Gail, connect the dots.
And I'm so glad you brought the evaluation piece up, because it's something I didn't get a chance to talk about. But we truly want to bring down the numbers, and we evaluate everything. So even our social media, we do a very robust we call it an educational, we have an educational calendar. Each month we focus on a different subject. We really work hard to evaluate that. Even are we getting the message out? Where could we improve? So it is kind of like, we want to be able to show what we're doing is making a difference. And that's why I think with improvements that we're making to data, trying to be more proactive about specific regions that are having issues, and then applying the outreach and education to it, that it could be really a really good turning point to reducing the fatalities.
Thank you so much. Thank you so much, Gail. Thank you so much, Kathy. There are a few questions and comments in the chat. We'll get back to those. One of the questions, I know, Gail, you do have, we have resources asking how we worked on safety of railroad crossings for older adults. I don't know if you want to quickly address that.
So that's a really good thing to talk about, is that we do partner with a lot of other initiatives that are through DOT as well. So wrong way driving is a great example. We develop resources to support that statewide initiative. So we do the same thing with railroad. We Operation Lifesaver, and with DOT's Alert Today Florida for pedestrians, so that we're not recreating the wheel anywhere, that we're really, again, taking that collaboration a step further, because I do believe it helps.
Exactly. Well, thank you so much, Gail. I really appreciate you sharing all this information, and we'll get your PowerPoint out to everybody with those great QR codes. I love that, so that we can go and pull up those resources. Thank you so much.
All right. Thank you so much.
All right. So next on our agenda, we're going to be hearing, we've heard a little bit of some statewide examples of work that's happening, but we wanted to hear from Miami-Dade County and their age-friendly initiative that they've been working on, to really hear some best practices that maybe those of you listening could use some of the examples in your community as well. And today we are joined by Isabel Rivera, who is the age-friendly manager for the Miami-Dade Age-Friendly Initiative. Isabel, thank you so much for being here today.
Thank you, Laura. Thank you for having us and for helping us highlight the great work that's happening in Miami-Dade. I'm excited to share some examples of things that are happening across our county that might give ideas to other communities around the state to implement as needed and as interested in your neck of the woods. So today I'm going to talk about our collaborative and collective impact regional model here in Miami-Dade. And next slide. And our initiative is a collaborative effort to create a community where older adults of all ages, where they can stay active, engaged, and healthy with dignity and enjoyment. Next slide. Just like in the rest of the state of Florida and really across the world, our community is aging. It's expected that it was expected actually by last year, we would have more older adults in our community than children, and that number is going to continue to rise. And if we go to the next slide, you'll see we really wanted to focus on age-friendly. Most communities were not built for this shift in demographics. Our economies, our policies and communities were not built to accommodate an aging population or aging in place, which we've talked a lot about today. And really, really importantly, how well Miami-Dade responds to the aging phenomenon and meets the needs of older adults will depend on how we prepare our communities to do so and how we work together to do that. Collectively working towards sustainable change will help us ensure that our communities is a place where people of all ages can live with quality of life that they need and deserve. Next slide. And in Miami-Dade, our older adults are a prized demographic with their active voting participants. They have significant buying power. They have a wealth of job experience and community experience. They are part of what makes Miami-Dade diverse and dynamic. We want them to stay in our community. We want them to be able to age in place and stay in the community that they love. Next slide. So our Miami-Dade Age-Friendly Initiative is led by 8 what we call lead agencies. This is a model that was started here in Miami-Dade. It's regional, it's focused on collective impact. We work with the AARP Florida with our Alliance for Aging, which is the Area Agency on Aging, the Health Foundation of South Florida, our Department of Health here in Miami-Dade, of course, our county, the Mayor's Initiative on Aging, our Transportation Planning Organization, the United Way of Miami-Dade, and Urban Health Partnerships. Urban Health Partnerships serves as the coordinating agency, and I'll talk about that in a moment. But we also have a group of stakeholders, over 60, that help advise the group and identify ways that they can collaborate on the work we want to do. We have a group of older adults that also advise the work. And we have these coordinating agencies that I mentioned, each have a staff member assigned to our Age-Friendly Initiative, and we meet monthly with them. And our work is focused on collective impact, on a framework of policy systems and environmental change. And thinking about collective impact, you can go to the next slide, sorry, Laura. There's 5 things that you need to, when you're thinking about collective impact. The first is a common agenda. So we have that because of our shared interest in age-friendly communities. Also, we developed an action plan together through a results-based accountability model. And in that model, we developed a shared measurement system. And we have, through our action plan, mutually reinforcing activities. Also, our communication is really important to be able to help each other promote age-friendly activities throughout the county and to be able to support each other. And then we do have a backbone support agent organization, which is Urban Health Partnerships, that helps to coordinate between all of these agencies. Next slide. We are focused on the domains of livability. A lot of our work to date has focused on the built environment, outdoor spaces, buildings, transportation, and housing. And then we have begun to promote and support activities related to all these other social environment activities. I'll share a little bit about that in a bit. Next slide. This is just to highlight, again, our PSC model, the policy systems and environmental changes, thinking about healthy aging and healthy aging in place. We want to be able, with our limited resources and time, to be able to make the biggest impact. So our work has focused on the socioeconomic factors and also changing the context. So thinking about the policy systems and environments that might help support an individual's default decisions to be healthy. So we want to make it easier for older adults to be healthy, to have access to the things that they need to be healthy and to age in place. Next slide. So our policy systems and environmental change work has focused on these areas to date. So their leadership, older adults in all policies, age-friendly parks, age-friendly neighborhoods, awareness and capacity building, and of course, the age-friendly network and designation. Next slide. So like many communities across our state, Miami-Dade is an age-friendly community. We joined the network in 2016. Next slide. And this is a photo of our prior mayor, Mayor Jimenez, who helped us join the network. A photo of and a proclamation that was done to make the day that we got the certificate as age-friendly day in our county. We have a new mayor now, Mayor Living Cava, who is a wonderful advocate for age-friendly communities. And as a commissioner, she also promoted age-friendly communities to the municipalities that she represented. So we're so excited to have her leadership and support as we continue to grow in our age-friendly efforts. Next slide. In addition to Miami-Dade County, we have 11 other municipalities that have joined the network or have submitted their applications to join the network. We also have 2 other cities that have already passed resolutions to join the network. One of our goals as the county-wide initiative is to promote the cities joining the network. There's so much more that can be done at the neighborhood level and at the city level. We want to be working together to identify ways that we can support people at the city level and also identify ways that we can make larger changes that are county-wide. So we want to be seeing these age-friendly changes at every level. And we're helping these cities to join the network and to do their surveys, do their action plans, and implement projects. Next slide. We've also focused on age-friendly policies. We call it older adults in all policies, making sure that older adults are considered in every policy that is passed. So next slide. And how we do this is ensuring that there's an age-friendly lens when that policy is being looked at. Next slide. So to date, we've been able to help advocate for age-friendly amendments to the Comprehensive Development Master Plan. That's something that the county manages. The Long-Range Transportation Plan is something that our transportation planning organization manages. We've also been included in the Miami-Dade Complete Streets Design Guidelines, ensuring that as people use those guidelines, that they're thinking about designing for older adults. We've been included in the Resilient 305 plan, which is focused on resiliency throughout Miami-Dade and the city of Miami. And we developed a housing policy scan where we identified age-friendly policies across the country and even some in other countries that we thought would be good examples or good things that could happen here in our county. And we went through and identified what's already happening and where are there gaps, not only in Miami-Dade, but some of the largest municipalities in our county. And that's being used as a document to have conversations and take next steps for housing in our county. Next slide. I wanted to highlight the Miami-Dade Transportation Planning Organization because they've been such an amazing lead agency and partner. This is something that any community can think about incorporating in their neighborhoods, in their municipality. There should be a metropolitan planning organization that pertains to your community, and they are in charge of designing the plans for transportation, all types of transportation for the community. A couple of years ago, our TPO plan passed a resolution to promote age-friendly design and accessibility in their projects. They also have incorporated age-friendly considerations in some of their policies and have developed an aging road user strategic safety plan that was inspired by the state's plan, and I'll share a little bit more about that later. But this is a partner that we might not think about initially, but it has been a really amazing resource and has really taken leadership in this area. Next slide. Age-friendly neighborhoods. Next slide. We focused a lot on pilot projects in neighborhoods to show what can be done more at a local level. So we did a project called Safe Routes to Age in Place in a local neighborhood called Little Havana. And as a pilot, we also developed an age-friendly business district. A lot of those connections have been really important in some of the work happening in Little Havana. Again, like I mentioned, the Transportation Planning Organization has been a key partner. And as a result of their aging road user strategic safety plan, they also developed road safety audits. So they identified places around the county that had more crashes happening around senior housing. And they developed a priority list of where road safety audits needed to happen first. So the first 5 have already been developed and completed, and their findings are going to be implemented and they're being incorporated into plans to make that happen. Next slide. And a big part of our initiative is really focused on awareness. Next slide. So we want to make sure that people know why the Age-Friendly Initiative exists, why we should be focusing on older adults, that we're all aging. So really this initiative is for every single person that is in our community. And it's really planning and developing a community that's for our future. Some of the work we've done related to awareness is a study on community leader attitudes towards issues affecting older adults. We found that our leaders, when we asked them what are the biggest issues for our community, older adults didn't come to mind immediately when we did this study. But when they were asked about older adults, they did say, yes, it's an important piece that we need to be thinking about. We want to be raising awareness among our elected officials that older adults are really important to our community and that we need to be developing plans and systems to allow them to age in place. We also implemented an awareness campaign. We've held 2 summits, which have been really well attended. We've had several workshops and capacity building events. We actually had a really great webinar last week, which I'll talk about in a few minutes. We have age-friendly resources, and we've also done a reframing aging training for communications professionals of organizations that we work with and for some of the agencies that we work with, to highlight the way that we talk about aging, to ensure that we're talking about it in a positive manner, and to really have them think about how we reframe aging and really how we reframe this entire conversation about older adults to make it more positive and to build support. And that was really well received. We're actually planning to do that again next year. Next slide. We also have now for the 3rd year had age-friendly mini grants. So these have served kind of a dual purpose. One is to help build awareness for age-friendly in the community. We've had hundreds of applications for these mini grants, and we've been able to activate projects all over our county related to older adults and age-friendly practices. Next slide. So here again, the goal of this mini grant program is to activate these pilots of age-friendly projects across the county. As a result of these, we've had a mix of mini grants that have gone to municipal governments, to nonprofits, to health service organizations, to universities, a big mix of projects as well. Next slide. Today we've had 15 mini grants. The prior 10 of them, most of them have said they've had major impacts, results, or achievements associated with their projects. One was able to expand its scope beyond the initial proposal, transitioning it to be more scalable. So they've actually gone bigger, not only just sustained it, but gone bigger. One project published its research in the Journal of Aging Research and also presented the results at 5 international conferences. One project was able to secure an additional $50,000 to expand its work. And these projects have impacted over 65,000 individuals in our county. And that's not counting the 5 new projects which launched in 2020 that were around 3. So if you go to the next slide, I wanted to share a little bit about those projects. One is with a group called Mind and Melody. They actually started a foster grandparent program virtually with elementary school students, and the virtual programs included a music segment designed and co-facilitated by Mind and Melody and the foster grandparents. Next slide. South Florida Seniors in Action actually developed a group of mini seminars that covered topics about resources for older adults around transportation, mobility, healthcare, personal care, wellness, and nutrition. Next slide. The Miami-Dade's Community Action and Human Services Department, or CASHG, they're going to be installing 2 iPad kiosks at their adult daycare to provide internet access and technology training to the participants in adult daycare to allow them to socialize virtually with their families or even access telehealth. Next slide. The Miami Worker Center has an aging customer base, and they have been able to install and make their entrance more age-friendly to prevent falls and to make it more accessible for any ability. Next slide. And lastly, the City of Miami Empower 60 program is a civic engagement training that they developed for older adults. We actually have Michael Roman here from the City of Miami. He's going to be presenting a little bit more, so I'm not going to give it all away, but it had really amazing results. Next slide. And I wanted to just highlight again opportunities to collaborate at all levels. So first is to promote and share age-friendly services in at the county and municipal levels. We have a really amazing mayor and mayor's office. You're going to get to hear from Susan Holtzman, who works with the mayor's office and is focused on older adults and special needs. They have been really focused on ensuring that older adults are included, and livability is included in their new budget for next year or for this coming year. Thinking about how we can partner not only at this municipal the county level, but at our municipal partners as well. Second is to ensure that we advocate for age-friendly and older adult lenses in all policies. So this doesn't mean creating a new policy. It might mean looking at what's already existing to see if it's age-friendly. Could there be a tweak that could help things be more age-friendly for our community? Identify what's already happening and ways to partner. So again, find new partners. Usually when we talk to partners, new and old, about what we're doing, they're all in, they see the value, and making sure that you make the case of why their work also applies to age-friendly is really important. And lastly, identify opportunities to collaborate on the age-friendly action plan and evaluation. So identify who are the partners that might be able to help you do what you want to do for your community. What's already happening, and where is the overlap that we might be able to work together. Next slide. I want to end with some resources we've developed over the years. So one is an engaging older adults in transportation planning document. The next one is an age-friendly parks toolkit. I didn't talk a lot about but our age-friendly parks has been a really important piece of our age-friendly work. Our Parks Department developed standards for age-friendly parks, and they have now, I think, 8 active older adult parks around the county that include programming and equipment for older adults. We have a toolkit around the age-friendly business district we developed in age-friendly businesses. We have resources around data and surveys that we've conducted, and we have our age-friendly action plan on our website. So our main website is agefriendlymiami.org, and we have links to those resources, to the events, our summits and workshop material, and to the mini grants if you're interested in those as well. Next slide. And here's our website again and our social media. Thank you so much for the opportunity to present today.
Thank you. Thank you so much, Isabel. This was great for all of this information and links to everything that we'll make sure everybody has at the end of this. I did want to take a minute to say that we are going to bring Isabel back up and the rest of the panelists from Miami-Dade to take some questions. So if you do have a question, please put that in the Q&A, and we'll make sure to get to those when we bring you all up. Thank you so much, Isabel.
Thank you.
And as Isabel mentioned, we are now going to hear from Susan Holtzman, who is the Older Adult and Special Needs Advocate in the Office of Mayor Daniela Levine Cava for Miami-Dade County. Susan, thank you so much for joining us today.
Thank you, Laura. My pleasure to be here as always. And thank you to all of the previous speakers. Really, what a great gathering we have here. I've learned so much. And so I've been scribbling notes as we've gone on, but there's a couple things I wanted to mention. So as mentioned, I am the mayor's older adult and special needs advocate. So there's always been an older adult advocate in the office of the mayor. In this new administration, we added to that role special needs, which includes mental health and disabilities. And the reality is there is a lot of crossover between those 3 areas, and I'll be talking about some of that. As Isabel mentioned, we are one of the sponsors of the Age-Friendly Initiative in Miami-Dade County, and the county itself joined the Age-Friendly Initiative initially and then the municipalities have been coming on board. So we are sort of an umbrella organization, and again, to Isabel's point about partnering, we are constantly partnering and collaborating with the municipalities, with the various community-based organizations to add to and promote the age-friendly approach and to provide support to that approach. We are fortunate to have had a lot of continuity here in that when the mayor was a commissioner, she was very involved from the very beginning with her first piece of legislation, as Isabel mentioned, had to do with age-friendly. I was her, at that point, volunteer advisor on aging, as I am a gerontologist, and so I represented her on a lot of these, with a lot of these organizations. So, and I continue to do that now as the advocate. So I've been able to have a lot of continuity as this has developed, which I think has helped us a great deal. One of the things that I wanted to mention is we do try to approach everything with an age-friendly lens. Very much, it's often me saying, wait a minute, what about this? For example, when the mayors started this administration, we did the largest survey ever done in the county. We had 27,000 participants. And initially, the age segmentation ended at 65 plus. So I requested that we increase that segmentation so that we had 56 to 65, 66 to 75, 76 to 85, and then 85 plus. And I think that's a really important thing to think about as we gather data to look at the various users, because there are changes within those segments that we're seeing in the data that we collected. So very important to think about that. Okay, I think you can go to the slide, the next slide. So we recently went through our budget process, and yes, there is a lot of age-friendly and age-aware items in the budget. Some of these were very intentional, and some of these I went through and found and said, you know, we really have to have a better understanding of how age-friendly we are and what's in here that is supporting age-friendliness. So very happy to see that within our housing, there's a great deal of attention to age-friendly housing, and housing is a major issue here in Miami-Dade County. There's a lack of affordable housing for people of all ages, but we really are focusing on building housing that is affordable to older adults and affordable to families, because many older adults live within the same quarters as their extended family. That's a very common thing here in Miami-Dade County. So a real attention put to that, also to put to the weatherization of homes so that older adults living in single family homes can get weatherization and can continue to age in place. This year, as many of you have experienced, I'm sure, there was a lot of issue around the budget, and as tax income was reduced due to COVID, we were very concerned that there might be an increase in taxes, but we were very astute with the way we handled federal funding. So we were able to continue funding all services for older adults, some actually additional services with home delivered meals during the pandemic, with no increase to taxes. Transportation, of course, is a very important issue for older adults and for people with disabilities. We were able to, and this was just approved Tuesday, there was funding included in the budget to implement the Better Bus Network, which was, the planning for that was work done with the TPO that Isabel mentioned. And so that's going to provide better bus services and accessibility. Our bus network had not been looked at since mid-80s, so almost 40 years. So this was a complete revision of how our buses work, what the routes are, what the accessibility is. We also, our Board of County Commissioners, did adopt Vision Zero. And the goal of this initiative, as Gail mentioned, is zero pedestrian deaths. So we included funding in the budget to adopt Vision Zero. Next slide, please. Community engagement is to me vitally important when we're working with age-friendly communities, and constantly trying to get that message across that this is an important segment of the population, it is a growing segment of the population, and it is an active segment of the population. So the team that I am on is the Innovation and Performance team here in the mayor's office. And I work with my coworkers, the other members of the team, to look at policy to meet the needs of older adults. So I'm working with George Damon de la Paz, who is a housing and data specialist. And we're working with Age Friendly Miami to compile a design guide to be used during the bid process to ensure that housing built for older and disabled people are designed to meet the needs of our aging population. So the important point in there is that this would be implemented during the bid process. So bidders who are going to be building housing for older adults, the more that, or any public housing actually, the more they include age-friendly design elements, the higher elevated their bid will go, which is a great way of building in policy. Also, we've added a new position, a tenant advocate, who will serve to navigate and connect vulnerable residents to housing resources. And right now, our older adults are some of our most vulnerable residents. One of the issues we have in Miami-Dade County is older adults who are low income are reduced to living in sort of rooming houses where they don't have leases and nothing in writing. So for example, during the pandemic, they could not get rent relief because they had no legal standing. So we're looking into that. Another important thing that we're doing, and I'm very proud of this, the county operates one assisted living facility. And when we looked at what was happening at that assisted living facility, we found that the wages for caregivers there were below the livable wage that had been passed in the county. And the reason for that was because part of the funding for those caregivers came through federal funding. But we were able to rewrite in the bid process so that the wages for those caregivers will have to meet our county's livable wages, which is just, I think, really a very important first step in supporting those caregivers, those paid caregivers who in the past have been underpaid, which has created an issue in finding care at home in order to age in place. In addition, we realized with the growth of our aging population that we are going to continue to have a larger population of people who, although they may not have been disabled for life, they now have mobility issues, they might have vision issues, they might have hearing issues. And we really need to be able to look at all of our county facilities and our policies to make sure that we're meeting their needs. So we've added 3 staff members in the Office of the American Disabilities Act office, we call it. And so we will be constantly being able to look at that. And I think that's a very important factor also. Next slide, please. Oops. Oh, there we go. As Isabel mentioned, looking at everything that we do, partnering with community organizations to sort of, and I do this all the time, and I know Isabel could expound on this, but looking at what organizations are doing and say, well, how can we just add a little age-friendly twist to that? For example, we talked about urban health partnerships through other grant funding, did a walking tour of a historic area of Miami, walking tour of Overtown. Now, they were looking at doing one in another area, in an area called Richmond Heights. And we said, well, let's make sure that we really make an effort to get the older adults involved and students involved so that the history of that area that's going to be reflected in the walking tour provides an opportunity for intergenerational collaboration. So things like that, always looking at things through an age-friendly lens. Talking about resilience and livability, we have a new position here in the county. We have a chief heat officer, and her role is to plan resilience around extreme heat risks. And as we know, our older adults are among the most susceptible to issues with regard to heat. So she'll be focusing on reducing heat islands in our more urban areas. And these are areas that are overheated due to lack of shade and too much concrete. We also have a large budget this year for an increased tree canopy, which seems like a simple thing, but when you think of an increased tree canopy along streets where older adults are walking, then just that addition of shade is going to make everyone more comfortable and really more safe health-wise. Also talking about civic engagement. And this was one that I found, I'll be honest, I found this in the budget. I grabbed onto it and I elevated it and I've shared it with all of our older adult advocate organizations within the community because it's so important. We had additional budgeting funding for vote by mail informational materials, increased stipends for poll workers, which our poll workers are often retirees. And also, of course, having more poll workers makes voting more accessible. A vote by mail ballot inserter. And also they're adding an elections logistics technician to implement coordination of new and temporary polling locations, again, to make it more accessible for older adults and people with disabilities. And as I said, in sharing that with our civic organizations and really helping them to understand how this can impact the older adults in our community, we were then able to get them more interested in the budget process in the county, which is also one of our goals. So we want them to look forward to next year being involved. We had plenty of organizations come out and speak at the Board of County Commissioners meeting in support of these items in the budget that will enhance the lives of older adults. And all because we try to look at everything through an age-friendly lens. Also, as far as the mini grants go, I wanted to mention, and I was involved with I was on the selection committee for the mini grants. And the one that you're going to hear about next is a model that took place in the city of Miami. And we're very interested in expanding that model county-wide. So that's one of the goals of those mini grants, is to find things that can be scalable. Have a pilot project and then be able to share. Look, if you're interested in doing something, here is the basic project is here, the basic framework is here. Let's see if it's scalable. So we consider that a real win, that these projects are being scaled and shared. And one other thing that I think I forgot to mention that I wanted to go back to is by segmenting the data that we collected on our 305 survey by age, we are now able to share that information. We also did segment it geographically with our municipalities that are age friendly or that are looking at becoming age friendly, so that they actually have some recent survey information, so that will help them in developing their action plans. So that data sharing point that Gail mentioned also is very important when you look at especially developing those action plans. What are the sources for data? How can they be shared? And are they segmented in a way that will be useful to us in our age-friendly work? So thanks very much.
Thank you so much. I really appreciate it, Susan. And thank you for going over the budget. It's so fascinating to see how looking at the budget, how that can have an impact on Livable in all the different areas. So thank you so much. I really appreciate it. As a reminder to everybody, if you have a question for Susan or Isabel, please put it in the Q&A and we'll get to that after our next presentation, which Michael Roman is the Community Partnerships and Strategic Development Manager for the Department of Human Services with the City of Miami. And thank you so much for being here today, Michael, to share your story about one of the grants that you guys received.
Thank you so much for having us. And of course, I do have to give a huge thank you to the Age Friendly Initiative. With their mini grant, they were able to help kickstart this program. And we're very excited, not only for the work that we've done in the city of Miami, but hopefully to be a model for other municipalities in our county and our state, across the country, and maybe even internationally. So let's dive in the effort of efficiency. I'll go through some of these slides rather quickly, but hopefully I'll be as detailed as possible. We did launch the City of Miami Empower 60, and in this program, it really allowed older adults to learn strategies for engaging and working with local government. As Susan mentioned, we do see a lot of older adults in Miami and Miami-Dade County that are very engaged within the community. They're engaged with trusted partners, they're engaged with each other. But we wanted to take that step further and look more at civic engagement and break away from the traditional, let's have older adults volunteer and let's move toward how can local government and older adults work together to achieve some common goals. Next slide, please. So just a recap of Empower 60, it was a 4-week academy in 5 districts in the city of Miami. It was specifically designed for older adults, preferably 60 or over. And it was a weekly course. We met for 2 hours, and it was facilitated to help participants increase their engagement and work with local government. Over the 4 weeks, a lot of the topics included public safety, clean and beautiful neighborhoods, growth and development, education, economic access, and the list goes on and on. I'm going to dive into each week and what we covered each week. But one of the interesting things was after the participants completed the curriculum, they created their own civic engagement plan. They received a small stipend for their time. And now they have many opportunities to put their skills into practice. And I personally have seen since the end of the curriculum, them come to commission meetings, them advocate for things that they want in their community. Next slide, please. So program eligibility, they were required to be a City of Miami residents, age 60 or older, and must be available to participate once a week in a course for 2 hours. Next slide. Week 1. So week 1 was really going over Government 101. Now, an interesting thing that even people who live in Miami don't really know is when we say Miami, Miami is often referred to the county, but having a city within the county with the same name can sometimes be very confusing, even for people that live here. The city of Miami is one of 34 municipalities within Miami-Dade County. So we did want to start the curriculum off with having an educational session on this is what the city does, these are the players in the city, this is what the county does, and these are the leaders in the county. And we wanted to make sure that our older adults know the difference between both of them. As well, we wanted to discuss who the city manager is, what the role is of the city manager, our elected officials from the mayor to our commissioners, city clerk, city attorney, and about our commission meetings and ways that the older adults are able to participate in commission meetings. One of the most important things as well for this week and the first week was we highlighted the elected officials, but even more so who their chief of staffs were, who their admin assistants were, and the easiest ways to get in contact with their specific elected officials. Next slide, please. In week 2, we dived in a little bit more about where are the offices located within their community. The city of Miami has neighborhood service centers, which are essentially satellite offices. So we wanted to highlight that there's no need for residents to come all the way to downtown Miami if they live in another community because we have offices there. We provided them with information on police and their neighborhood resource officers. Each community has designated police officers that are neighborhood resource officers that are there to answer any questions and be resources for the community. We also discussed code compliance and really dove into solid waste. How do residents report trash, illegal dumping, when their recycling was picked up, the scheduling, we went over everything. And then the last topic in week 2 was all the parks that were in their specific community. You can go to the next slide. One thing to keep in mind about each of these programs, since we have 5 districts in the city of Miami, it was very important to tweak each of these curriculums to meet the needs of that district. So we went into District 1 and said, these are the parks in your community. These are the offices in your community. And we wanted to make it as community focused as possible. In week 3, we really discussed growth and development and economic access. We discussed what community redevelopment agencies are and how to advocate for that in their communities. And we really dove into a lot of what my department, the Department of Human Services, oversees: employment, daycare centers, health initiatives, housing programs, economic and financial initiatives, and those neighborhood service centers. Next slide, please. And in week 4, we really honed in on a lot of the services that are available for our older adults, as well as efficient and effective government and working together with us. We highlighted some of the county programs, a lot of the transportation programs that assist older adults, like the Golden Passport. We discussed older adult feedings, working together, and their role as a community connector. Now, one of the things also to keep in mind is over the course of all 4 weeks, we incorporated the building of a civic engagement plan. So every week we carved out time to ask each of the participants, what are some of the issues you see in your community? Or what are the issues we discussed today? And what are some solutions and ways that you would like to advocate for that? And a little bit later, I'll show you the next slide. So I did want to go over some of the accomplishments first and foremost. We did have in the initial pilot 18 City of Miami residents that participated within this 4-week academy. Now, there were deliverables for each of them where they had to engage X amount of individuals. We also had one of our AARP chapters at Charles Hadley Park in our District 5 be very much invested and aware of this. So our total reach for the pilot was 240 residents. So from those 18 individuals, we have hundreds and hundreds of older adults that are interested in participating in this program now. As I mentioned, we provided stipends and provided resources and services for the participants so they can continue promoting wealth equity within their populations. We supported all of them in their civic engagement plan. We presented opportunities for them to implement their civic engagement plan, and then we encourage them to evaluate the success of a program. And we've created somewhat of a guide for other local governments. Next slide, please. So briefly, I did want to go over, we did incorporate a pre-survey and a post-survey because we wanted to capture the level of change. So as you can see in the pre-survey, many of the participants did not know the difference between the city of Miami, Miami-Dade County. They were not aware who the mayor of the city of Miami was. Most of them may have confused the mayor of the city with the mayor of the county or vice versa. They didn't know specifically which commission district they lived in or who their commissioner district was. They didn't know some of the services offered, how to connect with the city, or didn't even hear of the age-friendly initiative. Well, at the end of the curriculum, we did the survey again, and across the board, 100% of the participants now knew everything that we were asking. Next slide, please. So the civic engagement plan, the most significant results was that 100% of the participants created their own unique civic engagement plan. It included their participants' overall vision, their North Star goal for their own community, their topics and issues of concern, specific contact information to key staff that can assist them with their civic engagement plan, options and recommendations for the neighborhood, and implementations on next steps. If you go to the next slide, you'll be able to see what that, oh, I thought I had it there. Sorry, the impact was that participants now are heavily engaged. They're feeling a sense of empowerment. They're creating a sustainable plan to continue the program. And now we do see that they're more active, they're more engaged, just beyond the traditional volunteering that we've seen historically. Next slide, please. So some of the lessons learned. COVID-19 created social isolation, and there was a strong need for older adults to connect with the community. The program needed to be adapted to each community. So for example, some of the communities wanted to do the curriculum virtual. Other communities said, no, we need to get out of our houses. Is there any way we can do it in person? So we adapted for both. We also knew that language was going to be a barrier. So depending on where the classes were, we did do an initial assessment to see what language we needed to do the class in. Over the curriculum, we did the class in English and in Spanish. So for example, in our District 5 community, it was solely in English. In some of our other districts, we had a facilitator that facilitated the course solely in Spanish. Unfortunately, we didn't have any specific in our Little Haiti community, but moving forward, when we do have the need to have it in Haitian Creole, we will bring in a translator that can facilitate that in Haitian Creole as well. Next slide, please. Sustainability. We do see the importance of having a long-term 4-week program, but we are exploring a full day or half a day consolidated course to meet the needs of some of those older adults as well. We did even notice that although we had 18 individuals go through the entire curriculum, we did have quite a few more that attended for maybe 1 or 2 classes. But we did want to see the scope of who attended from beginning to end. We are currently meeting with other partners to share our curriculum and materials, and we are specifically looking at how can other municipalities roll this out or sustain this with absolutely no funds whatsoever. Next slide, please. And I think that's it.
That's it. Yes. Thank you so much, Michael. I really appreciate it. We had a question come in on the chat as you were talking, asking about language. So thank you so much for addressing how you were able to be inclusive of those that did not speak English. So I really appreciate that. I would ask if the panel could put your camera back on. We just heard some great examples of work that's happening in Miami-Dade. I know as I was listening to that, a lot of us are probably thinking, hey, some of this work is happening in my community right now. We've been working on this. So whether you, really categorize that yet as age-friendly, you can hear that maybe some of that work is happening in your backyard. I just wanted to take a minute to see for the Miami-Dade group if there were any questions. We do have one for you, Michael. Approximately how much should a municipality allocate to fund a program like yours?
Well, that's a good question. Luckily within the city of Miami, we have me, who's the community partnerships manager. So this is within my wheelhouse. So as far as hiring staff, that was not needed. So if there is not somebody who can specifically take on the ownership of this work, then of course, hiring an individual will be one of the greatest costs. This was a mini grant that we received $2,500. Most of the funds that we received were used for the stipends for the individuals, as well as for healthy meals and snacks, because we wanted to make sure that we were bringing water and some healthy meals. So if you do have somebody that's within their wheelhouse, and the city of Miami through the Age-Friendly initiative is able to provide you the tools, stipends are not necessarily needed. They do entice individuals. We do see that older adults are usually on a fixed income. So it does help with our economic mobility and our wealth within our older community. But to be honest, this can be done for $0. You just have to be very crafty. If you do want to be able to give back money to the community, then I would say at the very least, we were able to do this for $2,500.
Great. Thank you so much. I really appreciate it. Isabel, Susan, is there anything that you would like to add before we close out this session? We're going to share all your resources, and we so appreciate you being here today.
I just wanted to add that I'm so grateful to our partners and especially the leadership of our mayor's office. I didn't even know some of the things Susan shared about all the amazing age-friendly and livable community things that are happening in our county and in our next budget. So it's really wonderful to see the support and also commitment to age-friendly and livability from our mayor's office. So that's really exciting. And of course, we're so proud to partner with other cities to expand our age-friendly work. So thank you, Michael, as well.
Thank you so much, Isabel. And I was thinking the same thing we often talk about with age-friendly, look what's happening in your community already with housing, transportation, and how can you make that linkage? So thank you, Susan, so much for doing that for us today. I just wanted to see if there's anything you would like to close out before we move on to our next presenter.
The one thing that I didn't mention that I'd like to is it's just another example of really looking at where there's opportunity. And so my role as a mental health advocate, I spent some time in energy focusing and on disability advocate, focusing on the needs of those communities. And there's a lot of crossover. For example, in the disability community, neurodivergence or autism spectrum is a big issue right now. But some of the ways that you meet the needs of people who are neurodivergent is also really applicable for older adults who may have dementia. For example, a sound garden or a labyrinth maze in a park is really a useful and cost-effective way to serve both of those communities. So again, just always looking at that broader impact, that broader way. And when I mentioned that to our parks department and said, look, you'd be serving both communities, they were very interested. So always have to think that way.
That is an excellent way to end this. I completely agree. Thank you so much, Susan, Isabel, Michael. I really appreciate your presentation today. I wanted to let everybody know Michael did give an even longer presentation with some more information at Miami-Dade, had a sharing symposium last week. We will include the link to that video. If you want to find out even more, you can go listen to his presentation with some Q&A. So thank you all so much. And I want to turn to our last speaker today that's going to close this out for us. I'm so excited to have Bill Armbruster. He is the Senior Advisor for Livable Communities out of our national office in AARP, and he works with all the age-friendly communities across the US. And we're going to end today hearing from Bill about what resources we have at AARP and what are some new things that are coming out. Bill, thank you so much.
Great, thanks, Laura. And wow, what a group! Not only with today's group of panels, but throughout the last couple of weeks as well. This is just inspiring, and I was really glad to hear how much when you have and you support and commit to a community, how much that embeds in all of the work you do. And that is one of the things we hear from communities that have been entrenched in this work for several years, is now other departments are speaking this language and incorporating it into their planning. And the other thing that really struck me well is the sharing, partnering, and supporting each other. The one thing we want to make sure for any community that's going through this process is that you don't feel alone. I mean, being in Florida really puts you on top of the list right now in terms of what supports you get from the state, from AARP, from the communities that are already in the network. So if you are feeling alone or disconnected in this work, reach out to these folks, because this is not just the one time that they're here on a panel. They really want to not only do well in their own communities, but do that as well for you. So I'm going to spend a couple minutes just sort of going through some resources as we think about not going through this alone. What if you get an idea? What if you want to work on things? So I want to talk about just sort of some of the resources to help you along that process as well. The one thing that is sort of brand new on this page here is we actually, after many years, have our own AARP network of age-friendly states and communities logo. That is going to be available shortly to all communities. And you see here it says established 2012, which is when we started the network. But we have one for every year. So if you enrolled in 2015, if you enrolled in 2020, you can take the logo that is specific to your enrollment year. So this will be coming out with some guidelines on how to use it shortly. Next slide, please. We also, as part of this, our work across the country, we annually host Livable Communities Workshop. This past year was on, which was just a couple weeks ago, on engaging older adults and why it's good for the community. The good news is all the recordings, all the resources are coming out next week. So we'll have on-demand videos, we'll have the resources that were shared. If you get the AARP Livable Communities newsletter, the link will be in there, or you can see the link here, aarp.org / livable 2021. So you can go to that, and that'll be showing up next Wednesday. Next slide. I think, communities are at different places here. Some are just starting out, some are thinking of, or what's next, how do we redo this cycle? So we've created 6 modules. They're easy to digest. You don't have to sit through an hour and a half, 2 hours to look at each module. They're between 9 to 16 minutes, and they sort of go through the overviews of everything that encompasses age-friendly in terms of what is the network, what are the 8 domains, how do you enroll, how do you do an assessment, writing an action plan, and also doing your progress report. So again, those are available on our website. Next slide, please. We also, this spring, we just launched a members-only portal. So any community that is in the network, your point of contact for your community should have received an email that says, hey, join us and be part of the portal. This is a place for people from across the country can come, they can connect with each other, they can search for people, and it's not just for the point of contact. So if you have your stakeholders group in your community, you can go to them and say, hey, who else would like to be a part of this portal? And it just sort of cut off at the bottom of the screen. But for your stakeholders, you can add your own stakeholders, and we'll add an account for them as well. So we want this to be open to the people who are doing the work. So if you've got folks from your health department or not-for-profits or volunteers or planning, not only can they come in and participate, but they can join as well. And there's also a Florida-specific discussion group, so you all can connect specific on issues related to the work that you're doing. Next slide, please. And then again, this is, AARP's had a walk audit toolkit around for many years. Just recently, within the past couple of weeks, we have a revamp and a reissue of this. So it's all being updated. And the timing on this is very cool because, we're able to get back out in our community. So it's a great way to engage folks on the discussions of pedestrian safety, on, complete streets, on walkability. And if you're thinking about rehabbing a road or doing some work, why not engage the community and say, tell us what you see before you do the planning, instead of saying, hey, we went and looked, we know your community. Let's sort of flip that dialogue a little bit and engage people early on so their comments are included in the planning process. And it's not just gathering people out in one space to talk about it. Get to take people out in the community and really understand what they're seeing, what they're experiencing on a regular basis. Next slide. And again, other things, when we hear about issues that communities are telling us about, we try to put publications together. So we have a neighborhood improvement handbook that just came out this year. It talks about zoning, it talks about incremental policy changes, things to think about. A lot of our zoning may be in place for decades and may actually be detrimental to our work. What is it that we can look at? How can we change that? Next slide. And as we talk about publications, again, just came out last month, a booklet we did with 880 cities on homelessness in parks, addressing those issues and how communities could and should look at the issues related to homelessness and parks. Next slide. Again, all these publications are free. You can go on and order them at livable@aarp.org. You see a list of them here. We've got a home fit guide talking about home safety, what you should look at. the ABCs of accessory dwelling units, looking at pop-up placemaking toolkits. I just saw, I think it was St. Pete's has an open street event coming up that coincides with Halloween, getting people out in the streets, creating parks and public spaces, handbook for improved neighborhoods, where we live, which is examples from around the community, rural livability, housing toolkit, making room. And then we also have sort of guidance sort of as the how to go through this process in terms of the roadmap to livability, as well as many more. So like I said, you can submit and get it, or you can also go to the Livable Library at AARP.org, Livable Library. Next slide. So besides our publications, we also have other documents that are coming out. This is sort of very timely over the next couple of months, just being available to order this week. The ARPA, the American Rescue Plan Act of 2020-21, and older adults, making sure that you're taking advantage of the monies that's coming into your community, that every community is getting in a variety of different areas. So again, you can either download it or order it again this week. Next slide. And again, not only do we have the publications, we have videos with national experts from around the country. Eli Spivak's talking about accessory dwelling units, equitable developments, quick zoning fixes. You can see commercial districts, older people. All of these are on our website under, you can just sort of Google ARP Livable Lessons. Next slide. And again, other two videos that we have available through this year, making your home fit and backyard flexible housing options. Again, looking at issues related to accessory dwelling units. Next slide. And again, other types of topics that we have available. We have a livability index, which you can go in and see how your community, neighborhood, county, scores compared to other places either in your area or across the nation. The one thing to remember here, this is not like grade school where 90 is an A. Here 50 is average, and it's about how you score up from average or below, looking at topics of housing, neighborhood, transportation. We also have a searchable map, so you can find where there's other communities across the nation and find out what they're doing, look at their action plans, and also look at the ARP Community Challenge Grant recipients and what type of work they're doing. So it's all searchable map available. Again, the link is here. And then, as I mentioned earlier, we have our Livable newsletter, and you can either text or go and sign up to that. Sort of like a week comes out weekly, and it's a combination between the newsletter and a journal. And I think that's it.
That's it. Thank you so much, Bill. I really appreciate you going over all the great resources that we have at AARP right now. And I just want to emphasize the portal is such a great way to connect with others, and the training videos. I tell everybody to watch those. They're such really easy to listen to and fun and interactive. But thank you so much for being here today and being part of our panel. I also wanted to do a reminder to everybody that Livable Florida on their website and Elder Affairs also has a e-newsletter that just came out last week, and it actually talks about some of the work that we heard today. So if you have not registered for that and did not receive it, make sure to go to their website and sign up to receive it in the future. But I want to thank everybody who was on our panel today. What an amazing amount of information that's happening across the state. We will provide this recorded workshop for everybody afterwards and links to the presentations that we heard from today. So again, thank you so much. I really appreciate you being part of our sharing symposium. I hope everybody has a wonderful day. Thank you.